Timor-Leste is seeing an increase in HIV infections despite its efforts to contain the spread of the disease. Last year, Timor-Leste registered 348 new cases of HIV, while in the last 6 months alone, the young nation already reported over 150 new cases. Health authorities and advocates warn thousands are at risk as the stigma and discrimination leave hundreds of HIV patients untreated.
It's a quiet Monday morning at the Protv Clinic Antiretroviral Therapy Center, where health workers are waiting for patients to pick up their HIV medication.
In the last 6 months, we detected 19 cases. So, at the moment, we have 349 patients on active treatment.
The Protv Clinic in the heart of Dili is one of 16 clinics across the country that provides antiretroviral therapy for HIV patients.
The main challenge that we have here is the lack of reagents or HIV test kits, because the number of people who come here for testing is higher than the reagents supplied by the government.
Every month, the clinic receives 300 test kits from the Ministry of Health, but the clinic director says they've seen more than 400 people coming for the test. Since Timor-Leste reported its first HIV case in 2003, testing clinics have expanded nationwide, with antiretroviral treatment now available at regional hospitals. In 2023, the Ministry of Health and the World Health Organization introduced HIV self-testing and pre-exposure prophylaxis for high-risk groups. Despite expanded screenings, advocates say ongoing challenges around social stigma have kept many people living with HIV away from treatment.
Stigma and discrimination have kept people who were tested positive from returning to seek life-saving treatment. Some don't even tell their own partners.
The young nation has registered more than 2,000 cases of HIV/AIDS, including 400 deaths. According to the People Living with HIV Stigma Index 2024, almost 18% of HIV patients have experienced at least one form of a stigma or discrimination.
We need to reinforce and improve our counseling services to gain people's trust to seek treatment, because some of the counseling services that we have seem to judge and ask questions that make the patients uncomfortable.
While over 80% of people living with HIV experience self-stigma, including loss of hope, shame, and guilt.
We do psychosocial interventions to help patients accept realities and improve the counseling system to keep people coming for treatment.
Over 300 people living with HIV do not get medical treatment after they are diagnosed. Health authorities note that traditional cultural beliefs and reliance on local healers also discourage many HIV patients from seeking clinical care.
In our local context, deep-rooted cultural beliefs mean that even after entering clinical treatment, some patients drop out and turn to traditional healing and herbal remedies.
Advocates and health authorities said public awareness campaigns on HIV are crucial to stop discrimination and encourage people living with HIV to seek medical treatment.
We need to share information that does not scare and confuse people. We need to have a clear campaign on how HIV is transmitted, because it can be passed from mother to child, not just through sexual intercourse.
Our level of understanding and knowledge about HIV is still very limited. Despite our campaign effort, advocacy, and sharing of information, it takes time for people to understand, especially about ending stigma and discrimination.
Out of 152 new patients detected this year, 22 of them are not yet on antiretroviral treatment. As the fight continues, replacing fear with understanding remains key to getting more people into life-saving treatment. Pauline Quintown, Judas Magno, RTTL World News.